And I love it. I think that it's a subject that is taboo, that there's a lot of misconception, misunderstanding about it, and reversing sexual function or optimizing sexual function a lot easier than you think, but you need to know what you need to do early to avoid.
Hello and welcome back to another episode of the Thrive State Podcast. I am your host, Dr. V, triple board certified MD and performance and longevity expert. And if you are a man or have a man in your life, this podcast is for you because we dive into men's health and sexual health. You know, for many people, men are generally pretty reluctant to be proactive about their health. And one of the first things that usually wake them up is their sexual dysfunction actually picking in their life. Now, sexual function is actually could be a indicator for some other things that might be going on in the body, because sexual function is usually a vascular issue, which could mean that you are at early risk for getting stroke or a heart attack and so many other things. We're going to dive into this podcast. So again, if you're a man or a woman with a man in your life, you'll want to listen to this because it is really important information. Now, if you are new to the podcast, welcome in. This is a place where every week I get the opportunity to bring in thought leaders, experts in the world of health, longevity, biohacking, and peak performance. If you're returning to the podcast, thank you so much. If this podcast has given you value, please consider helping it grow by subscribing to the podcast, sharing this episode with your friends and family members, and leaving us a 5-star review wherever you hear or listen to this podcast. Now, as a very special gift to you, I want to give you something that's going to allow you to tap into your best state of health ever. To access this free gift, go to thrivestatestarter.com. With this bonus kit, you'll get breathwork exercises, journal prompts, and everything you need just to get started, just to get a taste of what it feels like to shift the energy in your body. Your energy is everything. Your energy is how you view the world, and how you approach the world is how other people feel you, but it's also the message that you're giving to every single cell in your body. So get a taste of that by going to thrivestatestarter.com. And if you haven't already, pick up my book, Thrive State, where we actually go through the 7 most important things in life for you to reach your Thrive State, which means to tap into the energy of peak performance of human potential. Now, on to today's guest. She is a good friend of mine. I actually met her at a podcasting event. She's got a huge podcast already, and she's a world-renowned, iconic expert in men's health and sexual health. And so on today's podcast, you'll learn about the 4 most important factors that contribute to general men's health and how they affect your sexual health, as well as talk about cutting-edge therapies as it pertains to sexual health. This is a podcast you will not want to miss. Ladies and gentlemen, please enjoy this conversation with myself and Dr. Ann Truong. Dr. Ann Truong, welcome to the Thrive State Podcast.
Thank you for having me here. I'm finally get a chance to be on your podcast. I'm looking forward to it.
I'm looking forward to it. Dr. Ann is a sister from another mister, fellow Vietnamese person. We'll dive into that story too. But before we start the podcast, there's a section of the show that my audience knows. It's called the 5 to Thrive. 5 questions, trivia style, rapid fire, 1,000 points each. And if you win, that means you get a healthy meal on me the next time we meet. So, Dr. Ann.
All right.
Sorry.
Yes, I'm looking forward to it.
Question number 1 is, if there was a sport that you could instantly master right now, what would that be?
Oh my goodness. Probably pickleball.
Oh yeah, I want to pick that up too. It looks super fun. 1,000 points there. Question number 2 is your favorite Vietnamese dish that you still crave from childhood.
Oh, bánh cuốn. That's my favorite Vietnamese dish.
Oh, that's a delicious dish.
Yes.
For those who don't know, they're basically big rice noodles with pork. They're delicious. Question number 2 is, what is your morning routine?
My morning routine, I've actually incorporated that recently. I've never really done it until the past 6 months. The morning routine, the first thing I wake up, I refrain from looking at my phone. I'll put half an hour. I will not look at my phone whatsoever. I will get up and I stretch first. So I get out of the bed, I bend over, stretch my back. I start kind of doing circles of my hips, 20 one way, 20 the other way. Do the same thing with my ankle because I get a little stiff. But once I do that, I'm great. I go take a shower, do what I need to do. And once I put on my makeup and everything, then I grab my phone. So at least 45 minutes, I refuse to look at my phone or any type of social media type like thing. And they said that it is helpful for focus and energy. And I really think it's true because it helped me not get distracted. What's going on for the day? It's really kind of helped me focus on what I need to do for the day. And it's amazing if your mind is not distracted by your phone, you have really more clarity and thought for the beginning of the day.
Yeah, no, that's beautiful. It's a beautiful practice that I implemented, and it's been a game changer for me as well. 1,000 points there. Question number 4 is, what is one unexpected thing that people would find surprising if they found out about you?
I'm an introvert in a way. I like my quiet time. People think that I'm just a super extrovert when they get to know me, but I think I'm a mix of both, honestly, because I like my alone time
Yeah.
and I like my alone walk, and sometimes just being by myself more. And sometimes I get a little overloaded with too much people around me. So I think that people will find that surprising, but they don't know because they don't see me doing it. And they always see me more in an outgoing extrovert personality, but there's definitely that introvert in there for sure.
Yeah, same here. Question number 5 is, what would be one word for you to describe the future of regenerative medicine?
It's going to be the way for the future. It will be the way how medicine is going to be practiced because we're starting to see paradigm shift in orthopedic medicine. We're starting to see that in gynecological medicine, urology, and regenerative medicine's been around since I would say probably early 2000. And there's more level 1 research coming out about the benefits of that in joints and muscles and even in culture cell expansion. Unfortunately, we can't do that in the US right now, but being done in other countries. And US doctors are traveling to outside the United States to practice regenerative medicine the way it should be done.
500 points there, but you get an extra chance of getting the 500 points back. One word to describe the future of regenerative medicine.
Thrive.
All right. Thrive. I like that.
Yes, regenerative medicine will help you thrive. I know
All right. So 5,000 points, which
you love that
a
word.
healthy meal on me the next time we meet. Can't wait to dive in here. Now, before we start getting into your expertise, I mean, you are a world-renowned, iconic leader in the regenerative medicine space and in men's health. But before that, you and I both share a common story. You were a Vietnamese refugee. Tell us about kind of the early years. Like, what were the circumstances that made your family leave Vietnam, and what was it like growing up in America as an immigrant?
In 1975, my dad is actually chief of police of what known as Saigon, with now Ho Chi Minh City. My whole family has been in politics. And so we left on a military plane, different than others. We left in April 1975 in a US plane and were taken to the Philippines where we stayed there until we got a sponsor. So we didn't undergo all the the boat trauma and all of that because my dad was in politics and he knew that he wasn't going to get the family out, that it was not going to be good. And then he joined us about a couple of weeks later. And so we stayed in the Philippines and then we got a sponsor, and it was a church. It was a Lutheran church who sponsored us in Connecticut. And we came there from 1975 and stayed there to 78 because it was too cold for my mother to handle. Now, my mother, if you know, a typical Vietnamese, female, they're very spoiled. They get their hair done. They never work a day in their life. And in Vietnam, she had a chauffeur and all that. And it was the Connecticut Northeast weather was too cold for her to handle. So we moved to San Jose, California. And that's where we've been since 78. I grew up there, and my brother still has a house there. My family has house. So I came here when I was 8, didn't know a word of English, had to learn that all in elementary. I came here much later than you. I think you came here when you were a little baby. And so much later, but I, assimilated fairly quickly. What really helped was that when we came here, because we were sponsored by the church, the children stay with a family in one of the church. So we were able to learn English very quickly, learn about American culture. And I remember my first taste of cereal. My sister and I stay in the same house, and we didn't know what cereal was. And my first taste of cereal, I was like, "Oh my god, this is so sweet. I can't handle that." It was something totally different as well. So in Vietnamese, we don't have anything sweet for breakfast, right? It's usually kind of more of salty food for breakfast, and I still am like that. I'm very much, we eat Vietnamese food all the time, and growing up in San Jose was a environment as well too, and so yeah, that's kind of like my story.
That's beautiful, and good thing you didn't eat cereal for breakfast because that's a cause of so much diabetes and metabolic dysfunction these days. So, tell us a little bit about sort of your journey into men's health and regenerative medicine. I mean, back certainly when I went to medical school and you went to medical school before I did, there wasn't necessarily that field. There was urology, and then there was general practice doctors that just looked at health in a very general sense. What specialty did you initially choosing, and then how did you discover regenerative medicine?
Yeah, so it really started in my journey for holistic medicine, alternative medicine started I finished residency in 1997. I was an academic and I mainly did interventional pain management, cortisone injection, facet injection, learn how to do floral and all that. And then in 2001, I signed up for UCLA medical acupuncture course, which took like 9 months to learn because you have to show up in person and then learn on your own. So I learned about acupuncture. So when I started learning about acupuncture, opened up my eyes about whole body healing and mind and body healing, which was totally separate from our training in allopathic medicine, right? Which is like an organ by itself and functioning by itself. But how is the heart connected to the fascia and how is the fascia connected to the brain? That we learned that from acupuncture. And so I started doing acupuncture from '01 to like '05, and I integrated that into my practice. And then I learned about prolotherapy, which is injection into the tendon with 15 to 25% dextrose, which then start healing process and through an inflammatory response. And that then about 2007 is when PRP started, being more prominent. So I started integrating platelet-rich plasma, which is using the platelets in your own blood to stimulate an inflammation response, which then lead to healing. I was doing that for pain management. I was doing that for all the joints and the spine using floral ultrasound guided injection. And then so it became a personal journey in the sense that my husband has heart disease in the family, not the best healthy eater. And, Vietnamese food is usually a lot of carb, mainly, and less protein. So he was starting to develop pre-diabetes and cholesterol and had a family history of heart disease. He actually ended up needing a stent, like two stented. He had 98% blockage of his RCA and LDA, both of his main arteries of his heart. And so he needed a stent. But what I'm leading to was that because of that, it also affects his sexual performance as well too. And it was killing him because he was a young man at that time, and the medication that he was on, well, of course, is contraindicated for ED medication. I didn't want him to go that route anyway. So, being at that time in 2012, at that time I was doing platelet-rich plasma for the joint, and I said, well, let's see if it works down there. And because if you can inject into the joint in the spine, you can start injecting into soft tissue. So we started doing that, and Lord and behold, it actually really worked really well. So then I started kind of doing it on my brother-in-law, my brothers as well. And then I find out ED is very common than you think. Once you start in conversation with people, a lot of people has it. So I started deep dive into it and kind of really learning the etiology of erectile dysfunction and everything else. And at that time I was doing hormones already. So it's kind of like a natural step and progression. And I started doing sexual health because of more for self-interest reason. And I love it. I think that it a subject that is taboo, that there's a lot of misconception, misunderstanding about it, and reversing sexual function or optimizing sexual function a lot easier than you think but you need to know what you need to do early to avoid. It's almost like I correlate sexual function like taking care of your teeth. You know, when you brush your teeth, you floss, you do mouthwash to preserve it. In sexual functions, the same thing. If you know what you need to do to maintain the optimal function of it, then, and you know what to avoid, then you can maintain it, you know? And a lot of time, you know, men don't realize that they kind of losing the edge in the bedroom. First thing they're going to do is go for that Viagra or that Cialis, which is the worst thing you can do because that actually make their sexual function even worse. Now, I mean, it may improve it short term, but in the long term, it actually make it worse. So, you know, I became more passionate about it because I feel that, you know, we're making an impact about it. And I was able to reverse my husband and, you know, thousands of patient function through lifestyle medicine, as well as using their own stem cell to help improve blood flow. But I want to add on that it's not just the procedure itself, is doing lifestyle medicine, which is lifestyle changes in their diet, the exercise, stress reduction in order to maintain function. Because if you get treated and you just go back to poor eating or don't exercise and your blood sugar is off in the double digit, then, you know, you're not going to have the long-term result.
Yeah, you know, a couple things that you said that stood out. Number one, you definitely were highly motivated because you were saying, you know, I got into it because of self-interest. I'm like, oh, okay, well, you're not getting any, so you got to figure out how. Oh, that works. And then the funny thing also I found was you treated your family. They came up to you and willing to drop their pants for the procedure. No,
You'll be surprised. You'll be
just
surprised. My brother was the second patient. The
oh,
brother that's 5 years older than me was my second patient.
oh wow.
And, you know, you'll be surprised once you start telling people what you're doing and your family reach out and, you know, they're my brothers and then my brother-in-law. True brother-in-law.
Well, that's amazing. So you're definitely very popular in the family, I'm sure.
I'm still treating them now even.
Amazing. So you mentioned something that was really important because, you know, a lot of times erectile dysfunction is really a signpost or really warning signs that, you know, the entire body isn't functioning. It just happens to be affecting your sexual health. And unfortunately, for men, they can go on with a bunch of symptoms, but when it comes to their sexual health, that's when they are like, oh, I have to figure something out. But what you're saying when you talk about lifestyle is there are things that are actually ruining the systems in your body. And one of those systems just happens to be sexual health, and it's a lot of these things start a lot earlier. So what are you seeing in men who are coming in? What are you finding in terms of their labs, their metabolic health, and are they generally coming in with any other symptoms? Because, you know, we really want to give men the warning signs early, and what might be some of these warning signs that they can get prior to it affecting their sexual health?
Absolutely. That's a great question. So men and partner of men, listen to this. Really, the first symptom they're going to notice, and it's an early sign of ED, is that they have no problem getting an erection, but maintaining the erection or partially losing firmness because the veins are what's affected first, not the artery. When it gets to the artery, when you have arterial disease, that's a totally separate matter, right? More severe. But it starts out as more that the veins are not completely compressed in the penis. So therefore you lose somewhat of firmness, you lose some rigidity, but then you're able to finish and everything. So most men don't feel that they have ED, but that's actually the first early symptom of ED is that fluctuation in firmness. Okay. And if you know that is an early symptom, the first thing you need to do is, okay, you ask yourself, okay, what's my diet like? Am I eating a lot of processed food, simple carb? Am I eating a clean diet, right? And two, what's my weight? Am I overweight? Do I have a high blood pressure, high cholesterol, or a high blood sugar? And then the other thing is, am I exercising at all? So I call this the four pillars: the diet, exercise, sleep. How's your sleep? Because sleep is when you make testosterone. And number four is stress reduction. So the first thing they should look at is check those four pillars and see where they're at. And then if they do the tweak of the diet, I would tell you out of the four, what is the most important thing they need to tweak to see big leverage is diet and stress reduction.
Mm.
Yeah, out of the four is diet and stress. Even if they exercise very minimally, but the diet still overweigh everything, and then the stress, because the stress will affect your hormones level, and the stress will also affect central mechanism in the brain as well too. So that's why I stress on stress management. And I'm not talking about asking men to do yoga, woo-woo stuff. I'm just saying, men internalize their stress. They don't express their stress out like women. That's my husband. He has stress. He doesn't talk about it. He'll internalize it and he like downplay it. But me, if I have stress, I go out and talk with my girlfriend, play tennis, play pickleball, and I just externalize everything, right? And so, like for that, for men, it's like go out and play sports or go for walks. Sometimes all that really reduces the stress symptoms. So that's what the warning sign is: changes in firmness, not so much ED. All right. So if you know those are the first symptoms, you want to follow that, and just don't make it the first time you have it, because sometimes you can be distracted too, or you're stressed or whatever. So if it happened, about in a month, and it happened more frequently, then that's something that you need to do an introspection and look at what you're doing with your lifestyle. Make a tweak at that, and it will go a long way. We work with over 7,000 men, and we see that once they start changing their diet and they start exercising more, their erection is reversed, period, without medication, without even stem cell injection by us. So if you start early, you can have greater improvement, longer term improvement. But if you start when you're like, well, I've been taking Viagra 10 years and all of a sudden it's not working anymore. Well, then, there's 10 years of disease progression of what we call peripheral vascular disease, right? Because ED is really poor blood flow and inflammation in the blood vessels that is causing poor blood flow. But when you get to a point where when it affects the vein, it's reversible. When it affects the artery, it's harder to do. It still can be reversible, but it depends on how much arterial disease there is. Because if there, but one thing that we can do a penile Doppler ultrasound to evaluate for arterial and vein blockage in the penis to see if there is enough blood flow in there. If it's arterial, then it's most likely not very responsive to regenerative medicine stem cell treatment. It's really more, you got to think about more vascular bypass or surgery at that time. But luckily, 90% plus of ED is really due to venous leak or vein, the condition that I talk about, more from the veins. So start early and pay attention to your performance. And the first thing you want to do is don't take those ED medicine, because what can happen, the ED medicine will only help with ED medicine increases nitric oxide in your penis, and therefore it helps with the erection. However, it doesn't help for libido, arousal. It doesn't help you find out why you have ED in the first place. Don't you want to know why?
I hope you're enjoying the podcast so far. If you are, I just wanted to let you know, join our community. There's so many free resources and a great community of people that desire health, happiness, human potential, to have more in their life, more health, more energy. And when you have those two things together, you could create more happiness, more abundance, whether it be financial, romantic, all these things in your life. And if you're just starting out, you don't know where to go, just sign up for ThriveStateStarter.com, because in there you're going to get a bundle of information that includes a longevity ebook, a longevity and performance resource guide, lecture notes that come from my keynotes at Google, at Fortune 500 companies, all the insights in that keynote in lecture slide form given to you. And then finally, breathwork. I share 3 powerful breathwork exercises to access calm, which really gives you clarity and peace during the day, to access energy if you need to wake up and really motivate yourself, and finally a breathwork routine that you could do every single morning so that you could be very intentional with how you create that day. You can find all this stuff delivered free to your inbox at ThriveStateStarter.com.
and our community is growing. If you want to be a part of a community of people that desire the Thrive State, that are really in Thrive State themselves, and help other people along with that, you could be a part of the community. You can get group coaching from me. We do breathwork sessions, meditation sessions, and you also get to drop in and participate in podcasts in the future. You could find more about the community at mythrivestate.com. That's mythrivestate.com. So check out those resources. You're not going to be disappointed, and please enjoy the remainder of this podcast.
Yeah, ED, there's always a reason why. ED doesn't occur on its own. ED is not inherited. And so it's the reason why you have poor blood flow that is causing that. And if you change your diet, your exercise, sleep, and stress level, it's going to be reversed. But in men that have been taking ED medicine for like 10, 15 years and say, well, it's not working anymore, then the disease progression had progressed pretty severe at that time, and they're going to need more intensive treatment. I'm not saying that it can't be treated. It can be treated, but with more the stem cell therapy, what we're doing, and various other treatment as well, too. I mean, we have helped a man that's 80 years old that's had 25 years of ED, and we're able to reverse his function again. And now he said he's having sex 3 to 5 times a week with his girlfriend who's 78 years old. So it can be done.
Making the world a better place, one sexual intercourse encounter at a time. Now, you bring things that are very important because, lifestyle and how we live our life actually changes the messages that we're giving to ourselves. And you mentioned the 4 pillars, and I'll repeat them again so people know, is exercise, diet, stress reduction, and maintaining good sleep. Because if you don't get those things, your circadian rhythms are off, your hormone levels are off, men are showing up with much lower levels of testosterone earlier in life. But when you fix those things, you could actually start dampening the process, or maybe even reversing the process. But, I know you do hormone optimization as well. At what point do you suggest men start to consider hormone optimization as a part of their routine versus, okay, they should just do it with lifestyle?
Well, that's a great question, because that's actually not a straightforward answer, because I attended a recent sexual health conference at Harvard, and a study that came out that looked at testosterone receptors. Testosterone receptor is different in every man. And what it means is that it's determined by your DNA. So what it means is that some men with just a little testosterone feel great. Some men with a lot of testosterone, they need a lot of testosterone to feel great. So every man's sweet spot for testosterone is different. So how does that translate into clinical medicine? Well, when we do blood laboratory tests, the range of testosterone is between 300 to 900, right? Now, you may be feeling great at 800, but when you drop down to 700, you may not feel as great. And when I feel, what are the symptoms of testosterone? Increased energy, better focus, more muscle mass, fat loss, mood, as well, libido, and sexual function are the main one. But some men, they're okay at functioning at 500 level. So it's vary in every man. So taking that into context, and I have seen it because my one of my colleagues, he's 77, he's not on hormone replacement therapy. Everything still works, great libido and everything. So it's also lifestyle dependent, because testosterone will dip with stress. And testosterone will dip if you don't sleep well as well too. And also it's affected by diet and exercise. So it's all those 4 pillars that I talk about. And so every man's sweet zone for testosterone is different. It's what I want to stress. And when should you start thinking about testosterone replacement therapy is when you start having symptoms. What are those symptoms? First symptom that I see the most is that they feel more fatigue. They don't focus as well. They're starting to feel that when they go to the gym, they're not maintaining the muscle like they used to. They're not bulking up as they used to. They get tired during the day, meaning at the end of the day, work day, they go home, they take a nap, they crash. They just don't have the motivation to go to the gym like they used to. They're starting to have fat in the breasts as well, love handles, and they're cranky, called moody. as well. Those are the little subtle symptoms that correlate with testosterone reduction. And if you're stressed, you don't exercise, you're overweight, then it will decrease more rapidly with that. So just know that men loses testosterone 1% every year after the age of 35. That's what you mean. If you're at 50, you only lost 15%, right? Which is not a lot. But if you are stressed, you don't exercise, you're obese, and you don't sleep well, it may decrease to more like 30 and 40, and then you become symptomatic. So it's about symptoms and quality of life, and that, if you don't won't have any more children, because it does, testosterone replacement therapy will decrease your sperm count. But I always tell my men, well, just donate it at a sperm bank and let it store there if you want to start testosterone replacement therapy earlier than not. But I would tell you this, we have observed that in men, if they change their diet to more of a clean diet, like a Mediterranean diet, that we have seen double in their testosterone level. I've seen men where they come in, their levels like maybe 334, poor diet, they change their diet, start eating clean, and then we get it in about 2 months, their level jump up to 500 something. So you'll see like almost like a 200 increase in testosterone level with just diet alone. So I would suggest that, men try that first. And then if they need some more, then I believe in testosterone replacement therapy. I'm on testosterone, so is my husband as well. I believe that it is anti-aging and it will improve your quality of life and really maintain your health status as you get older.
Yeah, amazing. Now, let's talk a little bit about those specific regenerative therapies, or actually, let's just take all therapies in general. I mean, many men have probably heard of therapies, including regenerative medicine injections. So that could be PRP, it could be stem cells, it could be exosomes or other type of growth factors. Then we have like red light therapy that's been on, and people hear about shockwave therapy as well. What are the ones that are actually working? And then as you evaluate a patient, how do you decide which therapies to put in combination, or should men do all of them?
Right. So for sexual health, so as we're talking about sexual health, it's different than the joints. Though I do both, but let's just concentrate on sexual health. So if you're looking at reversing ED, it's really more about adding more blood flow and rejuvenating the tissue. So when a man has ED, the penis also undergo atrophy of the muscle cell as well as incurring collagen deposition, meaning scar tissue. Collagen deposition, the muscle cell also shrink as well, and they have less oxygenation. And so it does shrink. It shrink quite a bit. And so you're fighting not only a physiological decreased blood flow, you're also fighting mechanical structural problem as well. And so it depends on the age of the man. If he's over 65 and he has multiple comorbidity like high blood pressure, high cholesterol, diabetes, then he's going to need the whole shebang. And what I mean the whole shebang is he's going to need platelet-rich plasma. He may even need fat stem cell as well. He may definitely need focused shockwave therapy. And now we're doing Botox. Yes, Botox that goes in the face. We're now putting it in the penis because it helped relax the penis muscle. Now, this is contrary to what we believe, but in order for a man to get an erection, his muscle has to be relaxed. The penis muscle has to be relaxed in order for it to allow engorgement of the blood in the penis. So that's the whole shebang, is the PRP, maybe even anal fat, maybe bone marrow, because we also do bone marrow as well, focused shockwave and Botox, and maybe that would be one treatment and maybe another PRP treatment as well. So focus shockwave probably needs about 6 of those weekly or twice a week for 3 weeks. And Botox is only one injection of 100 units. So those are all had been published research to show that it is helpful for severe ED. So I'm talking about the severe ED, 60 plus year old man with high blood pressure, high cholesterol, diabetes, and love handles. Now, if you're like, 47-year-old, right? A 47-year-old, 46-year-old, 50-year-old, and you just starting to notice that, you're not performing as well or not as firm as you used to be, and you're healthy and you don't have any high blood pressure or cholesterol issues, and you don't want to take medicine, and you try the diet, not helping as much, you try to exercise and all that, that person may just need the platelet-rich plasma alone. Platelet-rich plasma works well because it comes from your blood. Those are the platelets that actually has growth factors that stimulate more angiogenesis, which means more blood vessel formation with Shockwave, and you're probably maybe 3 Shockwave, and you're pretty good. Because the reason why I like Shockwave, focus Shockwave, not radio Shockwave. Focus Shockwave, low intensity Shockwave, is that it helps with the muscle. It helps with regeneration of the muscles. The PRP is for the blood vessel. The Shockwave is for the corpus cavernosum, which is the penis muscle. It helps break down the scar tissue, and it helps with more the flexibility of the muscle as well. So I like to use a combination of both to attack the muscle and attack the blood vessel. So it's a spectrum. As in clinical medicine, right? You can't use a cookie cutter formula. Everybody's a little bit different. Everybody have different comorbidities and how what their medical status is. So some men actually would tell them, "Hey, you don't really need it." From what I'm looking at the blood work, because every person that I evaluate, I always do comprehensive blood work by the time they come in. So I'll know what all their hormones levels are, their metabolic status, and by looking at their blood level and doing a penile Doppler ultrasound and getting a standardized questionnaire, we have a good evaluation whether, hey, is this ED psychological or is it physical? There is the psychological component as well too, right? And so if we do the blood work and evaluation, 90% most likely physical, but there is a large component of psychological too, like about 10-15%. And we can tell that by looking at the blood work. How do I know? Well, but the blood work pristine, they're young, they don't have any problem, they don't have any medical issues, but maybe they vape, maybe they do porn, and alcohol. Alcohol is actually a big factor in ED, chronic alcohol, because if you're drinking more than 3 drinks a day or 21 drinks a week, that's too much. So I recommend about 14 drinks a week, which is a lot, really, if you really don't want to get that inflammation in the blood vessels.
Yeah, you bring up a very taboo topic, which is porn. So, how is porn? Some people might not necessarily recognize what it does, but certainly, it could certainly affect both the psychological aspect as well as the physical aspects as it pertains to sexual health. So, let's expand on that topic a little bit because I don't think it's talked about enough.
Yeah, so porn, so what that means is that we need dopamine to be released to get aroused to stimulate the sexual response. And if you watch porn for a while, your brain is getting activated to, okay, I have this much dopamine release, but it doesn't know how much to release it when you're actually with a person. So when you're watching porn, you release maybe 90% dopamine, but when you're with a real person, you're only releasing 70. So it's not enough to stimulate that arousal response in your brain to stimulate your sexual response. So what it does is that it raises the threshold for arousal when you're with a real person. So therefore, that's how it interrupt the normal sexual response. The brain is the largest sexual organ, not the organ below the belt. It is the brain.
Brain,
Because the brain doesn't initiate that. Yeah. Really, it is. When I first started diving into it and I started learning about it, I'm like, that is fascinating. I never knew that, and that was fascinating to me. But the more I'm into it, the more it makes so much sense. But if we focus on here, everything else follow.
Yeah.
Honestly, and you know about that as well. So that's how porn messes up with sexual function and response. And also, porn also decreased testosterone level as well, too. The mechanism is probably more central because FSH, LH, is produced in the hypothalamus, and I think that it's affecting the hypothalamus along with the dopamine release as well. So it does decrease testosterone, but we also see that it also affect motivation. I have interviewed multiple recovered porn addict on my podcast, and they all say they decrease their motivation and get to a point where they actually isolate themselves from their family, from their work, just so that they can watch porn. It's amazing. It's almost like a what is that? A control from
It's an
you know
addiction for
the
sure.
TV.
Some people, yeah. So, I mean, this was very comprehensive, and I hope people just take away that, sexual health isn't an isolated incident. It really, the factors that cause sexual health will, certainly cause heart disease or chances of getting a stroke and just poor performance in life in general. So when you start to work on the underlying things, the four pillars like you talked about, you really improve not only your sexual function, but how you exist as a man in all areas of your life. And you talk about the regenerative medicine piece and the hormone optimization. Where do you see what's coming that's new, and what are you excited about that's coming probably in the next couple of years that will improve sexual health for men?
I think it's really more education. We don't need more medication. We need more education, and we need to be. You need to have open conversation about sexual health and not make it taboo, not make it something that is shameful. It is not shameful if you have sexual dysfunction. Sexual dysfunction is very common, both men and women. And it starts when, in really the best years of our life. It starts around when we're like in our mid 40s to 60s. It's really the best years of our life, right? And when as we're like enjoying our life again with, oh my God, things are not working in the bedroom. And so I think that where I would like it to go is that let's have open conversation like mental health. Let's not make it a shameful condition to have, because 50% of men over 50 will have ED. It's not if, will have ED. And I think that will be even more, because that was a study that was done in 1994, Kien. That's a long time ago. That's like 30 years ago. And that was done in 1994, pre-COVID. So I think now that more than 50% of men over 50 have ED. It's a lot more. And so I hope that we will have more open conversation, not make it shameful to discuss about it, and to educate men and women what they need to do to have sexual longevity. Because I truly believe that you can have sexual activity to the day you die. It's like your teeth, right? You can still keep your teeth to the day you die. You just need to take care of it. And you need to know what you need to avoid. And I hope that's where we head towards the future. And I know that I do regenerative medicine, but that's more for more severe cases. But my passion is really about prevention and education.
That's beautiful. You have a wealth of resources in your social media as well as your YouTube channel. We see you've got a YouTube award behind you. So how do people find out more about your work, your education, and if they want to come see you as a patient?
Yeah, so check out my YouTube channel where I talk everything about sexual health, and you can learn everything you need to do to have sexual longevity, even without seeing me. And that's on YouTube at Truong Rehabilitation Center. My last name is spelled Truong. That's my YouTube channel. And then my practice website is truongrehab.com. TruongRehab is where we see patients in the office for treatment, whether it's mild or whether it's severe ED. I want men to know and their partner to know that they do not have to suffer with ED alone, and that there are alternatives before they get an implant. And so I think that, now they're introducing implant earlier and earlier now, but I want your listener to know, as they're listening to this, is that do not consider that there are alternatives. Check us out. But I do want to give somebody a gift that are listening to this. We have come out with a Good Morning Wood smoothie formula that literally it will help with morning wood, right, or morning erection. And so if they go to goodmorningwoodsmoothie.com, they will get a free smoothie recipe it doesn't require a complex ingredients. It's just raspberry and blueberry, antioxidant and nitric oxide fruits and vegetables. That they drink it twice a day, they're going to actually start seeing improvement in their morning wood in about 3 to 4 weeks.
Wow, a morning wood smoothie. I didn't know I was going to get that treat, but I'm signing up for that recipe ASAP. Dr. Truong, thank you for being with us today. With all the medicines and therapies that you've seen out in the world, what has been your best medicine?
My best medicine is prevention. I think that but you need to educate yourself and you need to be your own health advocate. And nobody can be a health advocate except for yourself. Educate yourself, and prevention is the key, because if you know what to prevent, you don't have to deal with treating the disease. And all the problems that we see now in 2025 are all acquired, except for maybe cancer. But even cancer is acquired as well. Like high blood pressure is reversible, diabetes reversible, and high cholesterol is reversible. Even some cancer are reversible as well. And that's how I live my life in my late 50s. And luckily, I don't need to take any medication at this point and been fairly healthy. But I'm very proactive in treatment. Like I injured my left knee during a skiing accident, tore everything inside of it. The orthopedic surgeon said, if I don't get surgery, I'll never walk again. Well, I never got surgery, but I got tons of stem cell done in my knee with bone marrow, fat, as well as PRP, and I don't have any pain in it. But every year, I get my joints treated. I'm 58, so I get both my ankles, my knees, my shoulder, my hip injected with PRP to maintain it, because I know that I'm just going to get arthritis when I get older. But I want to walk until the day I die.
Well, beautiful. I mean, you are definitely beaming with energy and life. And so thank you today for your time, your wisdom here on the Thrive State podcast.
But thank you for having me here.
I hope you enjoyed that episode of the Thrive State podcast. And if you're finding that this content is really helping you and your family members, please consider supporting our mission and our cause of elevating health, happiness, and human potential for people all over the world. You can do so by making sure that you subscribe to this podcast, sharing it with your friends and family members, and leaving us a 5-star review wherever podcasts are heard. All these things are going to really help elevate the show and to give us the resources to continue to bring more content just like this to yourself as well as the people that you love. If you haven't already, you might want to consider joining our community. We actually have a community where people get to engage with me in group sessions where we do breathwork, meditation, where we do challenges together, really to be able to get us access to health, happiness, human potential, so that we could have longevity and performance in our life as well. You can check out our community at mythrivestate.com. That's mythrivestate.com. And if you haven't already, pick up a copy of my book, Thrive State. It really gives you all the tools, the pillars that you need to create a blueprint to control the energetics of your life. Who are you? How you show up in the world? The choices that you consistently make create an energy in your body, and you can control this. And when you can control that, you also control the messages you give to your DNA that gives you access, again, to optimal health, longevity, and peak performance. And let me also just share a free gift to you. If you haven't already, please pick up my longevity and performance bundle where I share lecture notes, ebooks, breathwork exercises, and longevity and performance resources at thrivestatestarter.com. Thank you so much for being a part of this community. Thank you for helping us grow. Remember always, my friends, that you are your best medicine.